this computer. Okay. All right, well, welcome everyone. Before we get the call started, I really want to take a moment to acknowledge the protests going on around the world and country right now after the tragic death of George Floyd. These protests are the result of hundreds of years of pain and systemic racism. And while this conversation today is focused on COVID, I know a lot of our hearts are feeling especially heavy. And I guess I didn't feel comfortable entering into the conversation without acknowledging that that's there. So thank you everyone for being here. And after the call or in the following weeks, if anybody needs any extra emotional support or anything like that, like I can only speak for myself, but I am here for you. And with that, I am going to just go over a couple Zoom housekeeping things. Thank you again for taking the time to be here. Before we introduce the panelists, I want to give a brief breakdown of the call so that everyone understands the structure of the call. We're going to keep everyone muted. There will be time for discussion at the end of the call. This call is being recorded. I ask that everyone please keep things respectful and remember that we're all here because we care. The first portion will be questions prepared with the panelists. If you have further questions during that time, just type them in the chat box and our chat box moderator will catch them for the end. The second portion will be questions from the chat box for the panelists. Our chat box moderator will be the one asking the questions for the room. And then the final portion is just going to be a popcorn style discussion for the entire room. So with that, the call is going to last until 7 p.m. If we find that the conversation wants to continue or spill over, we'll acknowledge when it's hit 7 p.m. so that people don't feel that they need to linger around and can if they wish to. And so with that, I'm going to have the panelists introduce themselves, starting with Zachary. Let's see. I think I have. Nope. You should be able to unmute yourself, Zach. You want to do that?
Works. You all know me pretty well, except for Molly may not very well. Zachary Gosney. I'm a pilot for Alaska Airlines. And I will be, I guess, discussing kind of how COVID has affected me and more specifically worldwide commerce. Seeing how the transmission rate kind of spread in that way, and ways that it's affected me personally, seen it affected out there in the large transmission rate, and then kind of how that comes home. So Zach Gosney, and I'll look forward to discussing things.
Oops. Up next, I have Dane. Dane, if you want to introduce yourself here.
Sure. So my name's Dane Owen. I know most of you. I am an ICU nurse at Salon Health. I work in a medical ICU. So I work with COVID patients pretty commonly, actually. So yeah, to what extent that my medical experience is useful, I plan on contributing that to the conversation. So.
Thank you, Dane. And then next I have Marsha. Marsha, if you want to introduce yourself. Marsha is a salon owner.
Whoops. Can you hear me? Can you hear me now?
Yeah, we can hear you now. Sorry, we had did there.
My bad. Okay. So my name is Marsha. Some of you guys know me and some of you don't. And so I am going to be talking about my experience and my point of view of being affected by COVID and what I'm doing or trying to do as a business owner, to do things. So yes, this is where I am.
Thank you, Marsha, for being here. And then last on my list, I have Lorin, who's going to be our chat box moderator.
Hey everyone. So yeah, just drop messages in chat box as the conversation progresses. I will keep track of them and relay them at the end of the call. So.
All right. Thank you, Lorin. This first question is for Dane. Dane, how has COVID affected your home life?
Yeah, I mean, it's definitely been, as far as, you know, it's changed all of my social interactions, particularly surrounding like my level of exposure, especially when things first started unfolding. It wasn't really clear how bad this was going to get. It wasn't super clear how transmissible this was, or really how dangerous it was to the general population. So as a household, we had to decide to really limit our interactions. At one point, we had to have a decision as to whether or not, because I had access to a trailer near my hospital, so I was able to stay away from home. So the first couple of weeks that things were really kicking off, I actually stayed down there, and we were having a debate as to whether or not it was safe or appropriate for me to expose Aletha and our roommate to me during that time. Now we're kind of reaching a point where for a long time we were keeping really strict quarantine where we really were only interacting with each other. Now we're considering the possibility of how to incorporate others. And so a lot of our conversation has turned from the standpoint of like strict social distancing and quarantine to one of harm reduction, and how to mitigate.
Right, so like more of what's an acceptable level of risk versus complete abstinence, for lack of a better word.
Right. Yeah. Yeah. So it's been a pretty impactful period of time. I'm particularly conscientious about interacting with people who have pre-existing conditions like heart complications or advanced stage. I think my particular demographic that I work with gives me kind of a heightened sense of the danger of this, whether that's for ill or for better. So I would say from a medical standpoint, based off of my exposure and experience, this is a much, much, much worse disease than the common flu. And so it's been interesting working with patients that are sick with this and picturing people in my community in that position. And so that's kind of shifted a lot of my sense of personal responsibility about protecting others. So,
Yeah, I feel that healthcare workers, especially ones working with COVID patients, have been hit on a very emotional level by this.
mm-hmm.
Thank you for sharing, Dane. My next question is for Zach. Like you're a healthy guy who wouldn't likely be affected by the virus, but could unknowingly spread the virus. How has that knowledge affected you in your work life?
Yeah, it's affected me in my work life in a kind of a two-part, and they're definitely kind of woven together. So first part I would say was kind of a looming unknown of, I know that I might have it. I also don't have the means to get tested. And I also know that I come in transmission with a lot of people. And so with those kind of three combined, it's been interesting, specifically working with the crews that I work with, for a few reasons. One is I actually don't get to see their face anymore. We fly the whole day, whole trip with masks on. And so that's been interesting and kind of brought to light some unknown factors. I go through the airport and security with a mask on. And so there's a fear in that as well of what is security doing. To the point of also in my personal life, we did go on a pretty strict lockdown as well. We have the 6 people in our house, but I did my best not to go to the grocery store even and have other people go to the grocery store. Not come in contact with as many people as possible, specifically those that are healthcare workers, which we have a couple on the call already. So it's kind of hard to do when a lot of our friends are in that space. And so it was kind of an interesting ramp up, as initially we weren't sure if it was that big of a deal. As Dane said, there was a bit of an unknown factor of where's this going to go? And then as it continued to build, recognizing that not only was it exploding, it was exploding due to the fact of the job that I work. And so that was an interesting thing to kind of grapple with. So I guess to kind of wrap up that into the answer of the question of being a potential super spreader and how has that knowledge affected my work life. In some ways, it's had some unknowns and some fear of the repercussions of the actions that I'm taking, continuing work, knowing that I might be a super spreader, having people on my airplane that could be at high risk, are all these unknown factors that I unfortunately don't have a whole lot of control over. Balancing my own gains as far as continuing to fly and make money while also wondering, should I stop flying? Was an interesting pill to swallow and something to discern. And then also seeing in some ways that interacting with my coworkers is almost more collaborative because we had a shared sense of understanding of what it was that we're going through, which was interesting to have a type of empathy that really crosses all social norms that would normally be in the cockpit or in the cabin as a whole.
Thank you, Zach. My next question is for Marsha. Marsha, as a salon owner, you haven't been able to operate during COVID. Well, I imagine you've been eagerly awaiting the end of lockdowns. Do you have any concerns about your health or the health of your clients as things start to open up?
Yeah, because for me, as a rule, because we are already working so close contact with people, we, as anybody in the healthcare industry understands, we have to clean up before and after. And so you kind of do worry. And we had to have all these regulations go in and have to prepare the salon for just so. And we have to be a little bit more creative about our PPEs because they don't really have PPE supplies on hand for us, so we got to come up with different ideas of how to do it. And I am concerned, but the thing is, it's like as a salon owner and as a self-employed person, nobody's looking out for you. And so you weigh your risk every day on, what are you going to do for yourself? And because there's no stimulus check coming for you. And if it does, it's not going to cover it. And so you go out weighing the risk every day. I'm asthmatic, but you do a risk assessment and you do the best you can. And I clean up and I do everything that OHA asks of me. And for me, I feel like I'm fortunate enough that I have only one studio, and I've only always just seen people on a one-on-one basis. So there's not a lot of change that I have to do, not as much as people with 6 chairs and 12 chairs and and they have all these different protocols and the revamping of salons doing. So, and then I have a different industry. Most of the time I have to see you, so I don't even have to look at you. And so I feel like I'm very fortunate in a way that I have a studio by myself. Most of my clients I already know. And so I think I can make it, but every day I have to go through this checklist of if I'm okay, if you're okay. We have all these things that we have to do. And it's a new reality, and it's the same thing when I came through looking and coming from South Africa when all of this hit, and coming from here and seeing different societies and social places, people dealing with the virus is different. And I feel like risk is different for all of us, And so we just weigh our risk and we do the best we can, and I cover myself up and I do what I can, and then I keep on moving forward. And I don't want to cause anybody harm, and I follow all the rules I can. That makes sense to me.
Absolutely. Thank you, Marsha. All of you guys in these careers where not only are you having to make decisions for yourself as an individual, but for so many other people, like, thank you for sharing your viewpoints in this. My next question is for Dane. Dane, how has being an ICU nurse with COVID patients shaped the way you've practiced social or physical distancing? You started to cover this in your first answer, but my question elaborates to say, how has that affected you on an emotional or personal level?
Yeah, so I think, part of the real challenge with this has been managing the sort of the optics of what I do. So there's an element of working with COVID patients. This was the first stretch of work that I didn't work with a COVID patient in probably a month and a half. But I haven't ever shown symptoms. And so there's kind of this, it's been now a couple of months. And so trying to determine what is the degree that I am more dangerous to the general population than anybody else. And that's been kind of an unanswered question for our household and for me personally. The policy that I definitely have at play now is I don't really, I don't interact with my parents, pretty much anybody over the age of 50. I've seen a handful of patients come through that were otherwise healthy people in their 50s who were on ventilators, or at least had unknown medical conditions. And so that really impacted how just individuals that you wouldn't necessarily think to be impacted by this in a life-threatening sort of way who were, has really kind of kept me at distance from people. Part of that, though, is, now trying to manage the expectation of like, okay, if I am going to assume that I'm not going to spend the next 2 years avoiding everyone, what is my degree of responsibility and how do I, conduct myself in the world? I think part of what I've started to notice coming into that is a lot of decision fatigue. Where, when a friend says like, oh, I don't care, I want to give you a hug anyway, I have to like stop and make a decision in that moment of what that conversation is going to look like and how to respond to them. And so I make a lot of those different decisions in a day. I have another partner that I recently started seeing again. And, so now there's an ongoing conversation with her.
She lives alone and is able to,
socially distance.
More isolated, but, with certain parameters.
Right. So now that's like an ongoing, I'm like, oh, well, like how much of that, okay, so you went on a hike, like how much information do I need to ask you about what your experience was and who you were close to or not?
But it's like, how nosy do you be?
Right.
And like how, and what's, personal autonomy and what's my responsibility,
right.
What's your responsibility, and how do we have sovereignty and still also have conversations about these things?
Right.
And so it's been challenging.
It's complex. Yeah. So I think trying to figure out, especially now that we're moving into, a phase where we're deciding as a culture, or at least as a government agency, to reopen, we're sort of just accepting that people are going to get exposed and that we're going to move this through the population. And so it shifted, I think, my perspective on how we do that and what my role is in that. Yeah, I think a lot of, from an emotional standpoint, is just a fair amount of like concern and worry and a lot of on the fly decision making that's not don't always make the best decisions. So, so you know, I think that's been a big challenge of this.
A lot of communication, and then a lot of communication, and the more communication, and it never ends.
The sexual health model, actually, of like, you know, contact tracing and communication, and, you know, is figuring out time frames of when people need to interact with different groups of people is actually really helpful. So
a lot of that, translates very well to
COVID.
Yeah, I've definitely heard a lot of the like STD talk conversations going around in relation to approaching the COVID world, and I can see a lot of parallels there. My next question is for Zach, which is basically the same question. How has being a pilot shaped the way you practice your social or physical distancing, which you started to answer? And then more specifically, how has it affected you on an emotional or personal level?
Yeah, I think I'm going to actually start by kind of picking off of what Dane and Aletha were just talking about. And it brings this question of mine of, we're ready for this to be over, but is it really over? And the answer is no. We're not actually out of this. And so how do we reconcile the desire for it to be over while recognizing also that it's not over? We still are kind of in this place of uncertainty with it. And when thinking about that question, I mean, communication is just on the forefront of my brain as well. It's so integral into the way that we need to move forward into this. And it is interesting, you know, the talk of, okay, that's great, but what about sovereignty? What about my need to have autonomy in this world while also communicating vigorously with one another? And that's something that I can get into later, but I think it's worth bringing up, and I think you guys bring up a very good point within that. And like, how do we move forward and recognizing that we're not sure if we're actually out of this yet? And I would argue that we're not. On to more of the question of practice social distancing and physical distancing. We have been, as I said, pretty rigorously distancing. We have started to go to stores more often. I am going to stores now. And more speaking to the emotional side of things, because that's something I didn't cover last time I spoke, was kind of another question that comes up is where you feel stuck in hopelessness, how do you make space for that emotion? How do you make space for emotion when you feel so stuck or so cornered within the quarantine or within the social distancing? How do you allow emotion to continue when you're so deep in feeling contained? Allowing grief, allowing sadness, allowing anger to come through is something that I've played with. Just kind of allowing that space and using this as an interrupt and as a tool for that emotion to play. One thing that kind of comes to mind also, and this is in relation to Dane as well, is having a relationship with death. What is your relationship with death? Because we're faced with it full front right now. And if you're able to have a relationship with death, then I think that allows for some emotion to start moving. And so I think that that's kind of how it's affecting me, is calling into question a lot of ways that we connect, and allowing space for more emotion to come through even when we feel locked down. And then, communicating as we continue to step forward into this.
Thank you, Matt. My next question is for Marsha. Marsha, actually, I'm going to be asking this question to all three of you, but Marsha first. What precautions are you taking in both your professional and personal life as things start to reopen? I think we've all kind of started to cover that, but if there's anything we missed, I guess I'd just like to gather it now.
Yeah. Well, kind of pretty much what, Dana and Zach was saying is it's, for me, I think I've always had a level of risk that I had to assess all the time. And so I've also already lived kind of socially distanced from everybody. I see my clients one at a time. I only monitor who I see when I see them, and I only choose. And then before I left, like Zach mentioned, your relationship with death comes in close contact, and it was kind of a familiar situation and relationship for me. So I felt a little bit guilty because I didn't have the feelings of the end of life and my life is ending when this pandemic happened, because I felt like I've already been in like several pandemics in my life. And so I entered this pandemic very comfortably because I've already situated my life in living in a place where I can leave at moment's notice and things like that. So, and living off my own will and being isolated has kind of been a thing for me. So now that I'm going in and we're opening up things, I still see my clients one at a time, and I weigh my options every day, and then we'll go from there. And my emotions it's definitely having to tell myself it's okay for me to feel the way I do. And for us, I know that COVID gives us 3%, and they tell us that you have 3% more chance of dying. But for some of us, we've always had 50-50 of dying. And some of us with 80% of dying every single day. So perception is everything. And so social distancing and me wondering how people affect, I feel like most of us, when we in our crowd, the way we have attached ourselves to each other is we already knew that before that we only wanted to surround ourselves with people, and we've already distanced ourselves from people who do not feed us well and stuff like that. So I think for some of us, this is a natural position and this is what's happened. But, we go on with our lives and we take the little moments that comes with this beautiful sunshine and our risk and everything else. And we take the joy of going down. Like my son today, he's going down to the protest today. And he says, Mommy, I'm going to the protest. He says, but while I'm going down there, I'm skating the sun and I just want to enjoy the music while I skate away all the way down to downtown and feel the sun on my skin. But I understand why I'm going down there. And that's the thing. It's like we all live at the end of life, but we're in between those moments where we see the sunshine and the moments we enjoy it. And in that way, we're okay. That's how I see it. And so I take you and I see if you need me. Our emotional need is more stronger than anything else. And I feel like some of us are dying of loneliness. Most of us are dying because of the effects that COVID is taking on us, and not of the COVID virus itself, but of the stress and the heart attacks and the strokes and things like that. So, risk.
Thank you for that beautiful answer, Marsha. That was very poetic and well put.
Yeah.
I'm sorry, did I cut you off? Did you have something else you were going to add?
No, I'm just like, thank you for giving me the space.
Sometimes the social cues on Zoom are
I know. That's one of the things we're struggling with is coming together now and realizing what is my socialness, Like it's being awkward. I'm so happy to see you. I really want to hold on you, but like, no, don't, Yeah.
Well, same question.
I just wanted to jump in really quick, just to bring right back at you with the death thing is kind of the last thought that I didn't fully articulate was that if you're able to reconcile with that mortality, then you're able to give life your full undivided attention. And that's a less poetic way of what you were saying, I guess just more direct. And I think that the way you said it was just absolutely gorgeous. So thank you so much, Marsha.
Same question, but for Dane, and then after Dane, we'll go with Zach on that.
So precautions wise, it's kind of I think what's coming clearer into focus for us has been, it's an interesting space where, so for example, this week I'd had a patient that I'd been in the room with for 2 nights, and we're doing aerosolizing procedures and they're coughing, and at one point like their vent got disconnected and goop sprayed everywhere. And then on my third morning, or like the third start of my shift, the doctor came in and was like, nah, we looked at his chest x-ray, let's test him for COVID. So now I've been in this room with this person for 2 days. Now fortunately, we have the faster test now, so the turnaround is 24 hours, but previous to that it had been 3 to 5 days. And so I would often leave the hospital without knowing the degree to which I had been personally exposed. And so my perspective shifts
week to week, depending on the level of exposure. So
right.
It's kind of a moving target,
right?
In some ways.
So I think part of what's shifted too is, for the mortality of this, is that I'm realizing that there's certain risks I'm willing to take as far as my own safety and like infection. And I acknowledge the right of each individual to choose their own level of infection. And so moving forward, I'm thinking a lot more in terms of a consent kind of model. And so initiating conversations with people that want to be in space with me, because for a lot of people, kind of reconciling ourselves with, for example, with death, right? Like we, as Marsha put so beautifully, we all take a risk every day, and there's that risk is uneven across our population, as is very well highlighted in these times. And so, and that, in this case, there are people who are more at risk for COVID than not, and when we were talking about, Zach's being a younger, healthier person, is less likely to be impacted. I think trying to adjust my behavior along the lines of consent and being more conscientious of what other people's preferences and desires are. To that end, we wear masks in public. So
we're kind of, do you mind if I chime in for just a second?
Sure.
We're kind of still negotiating this, kind of what the
Mm-hmm.
new model is going to look like, but we're moving to more of like we said, a risk reduction model. So trying to maybe do an 80-20 kind of rule or guide, so that maybe there's a handful of people we interact with each week, but it's a reduced number. And so
80-20 meaning if we were looking at 100% of the typical social interactions that we had, prior to COVID being a thing, maybe we're trying to shoot for only having 20% of those same level of exposures, right? So if a given week our household were to interact with 100 people in close proximity, instead we would move towards trying to limit that number to 20.
And having multiple people involved, other partners and a roommate, a big challenge of this has been, if it was just me, I could make more decisions kind of on the fly, but we're trying to be more proactive about it just so that it feels fair to everyone, because making decisions on the fly when there are lots of people involved intimately in your life makes it kind of challenging. So I think that's kind of part of the process, is just like, how do we set ourselves up in a way that we don't have to have that constant decision fatigue where we're like having to make a million decisions throughout the day, and renegotiate things with our roommate and other folks like constantly.
Yeah. Particularly if you have to have a conversation that, maybe is like, well, I don't want you to do that. Or, is a challenging, it opens opportunity for challenges as well. I also would be very curious to hear like what policies everyone else is kind of implementing for themselves. That's kind of the model that we came up with for our household. And I would be really curious to hear what other people are coming up with and how they're dealing with that.
Yeah, Zach, if you want to, as you answer this question, maybe kind of elaborate on some of what came up in our house discussion yesterday. I know a lot of what we're planning to do moving forward as a house, we talked about yesterday, and then a lot of it, I personally really needed this conversation to help build some of my ideas around it. I have ideas of my own, but ultimately I'm a community person.
Yeah. So kind of it's a very interesting topic. I think that on one hand, we do want to take a look at not needing to make decisions every single moment and kind of like not be so wrapped up in that. You can't be at full alert 100% of the time, right? You're gonna pass out in an hour. That just doesn't work. However, I also think that I would challenge you, Dane and Aletha, to also look at like, so I have this idea that one reason that we got ourselves into this situation as a world is because we optimize for efficiency. And the way to keep this from happening in the future would be to create interrupts within that efficiency. And so how this correlates to how we continue to socialize from here is to, well, not getting carried away with it, also have a communication before you do something. And it will be continuous and it will be emergent. And that is going to be more difficult, but I also think that in the long run will save lives. And that's not to say you need to ask every time you do something, but it is to say like, at least an internal dialogue. And maybe an external dialogue, and it's going to create some sort of interrupt before you go socialize sometimes. But that if that's a necessary thing to make our system more robust to this type of event in the future, being this such a transmission disease, contact to contact, I also see that having validity. I'm not saying that that's the right way to do it. I'm just calling that into question, I guess. And so in our house, what we've kind of gone towards is we had a house discussion, actually, like Abigail said last night, around what are we doing now? We're starting this transition into the next phase, whatever number it is that you want to give it. And what does that mean for us as a household? And kind of what we came to after doing our best to find a consensus within the group is that we have certain things, mainly going into other people's houses and people coming into our house, where that is a conversation before it happens. We also what we tried to do is come at it from a place of what can't we do? What are my boundaries? And then anything outside of that, I'm going to allow you to use your best judgment as long as it's not infringing on a boundary. And so in that, we're able to be a little bit more efficient with also creating barriers to too much optimized efficiency. And so that's kind of how we go about it. Lorin and Abigail can kind of chime in if I missed something, but that's the generality of the way that we went about it. And it did take an hour-ish to come to that conclusion. And so it's not going to be efficient all the time. Consensus isn't about efficiency. Consensus is about everyone being heard and coming to a complete understanding and coherence within one another. And that's really where I think that we can move forward in this, is really strive for that. Let me get back to the question. What precautions are you taking about it? Yeah, so the precautions that I'm taking is, it's kind of already been spoken about a number of times, I feel, at this point, but it's really in that communication piece. It's really in that I would like to do this, and how do you feel about that as a household or as, family? My dad is on the call, and it is something that I'd like to do, to go see him sometime soon. But sorry, Dad, you're at risk. And so like that's a communication both with my household, to see, okay, where have each of you been in the last 2 weeks, 3 weeks? And then also a communication with Dad about, okay, how comfortable are you with this? Where are you in this? How much risk are you willing to take on? This is everything that I can know about where I've been. And in that, you're allowing people to both have sovereignty as well as be rigorous in our communication. And so it's definitely a balancing act between the two. The goal is to have everyone be able to make their own sense making, and come to their own clarity, and then me come to my own clarity and work between the two of those. And that's kind of really where I see us going forward.
Thank you. I think the only thing I want to add to that is that when we talked about what potential boundaries might be in this, those boundaries weren't hard no's. Those boundaries were indicators of pause, so that we could then kind of interrupt our scheduled programming to have an expanded conversation, because I think so much of this is emergent, and I feel differently day to day on some of it, as new information comes out, or so on and so forth. And so we're trying to keep it as flexible and adaptable as possible. And then I guess with that, and unless Lorin, did you have anything to add to that, or? Okay.
The last thing I'd just like to jump in there really quick is one of my favorite really easy quotes is Noah Bateson: change changes change. And so as we continue to change, we're going to change the way that we change.
Yeah, exactly. And so as this emerges, I think a lot of our different tactics in relation to it are going to change throughout. So my final question before we move on to the audience chat box questions is going to be for Dane, and that is, Dane, do you have any suggestions as a healthcare professional in relation to how we can help keep our community and world safer as we start to move about our lives?
Ooh, I'm not an epidemiologist. I actually also acknowledge to it that Carl also works in a hospital and in an ICU, and she works in Multnomah County. So her experience has probably been different than mine. So if everybody's cool with that.
Yeah, I'd like an answer from each of you with the understanding that, of course, you're not epidemiologists, but more of if you could ask your community to participate in something, what might you ask?
Cool, totally. But yeah, if everybody's cool with that, I'd love to hear Carl's take too, if she's willing. But yeah, the big thing is, for me, is definitely being conscientious about public spaces. So in how we move through that, I think Zach touched on consent. And so when you're interacting with strangers in public and exchanging physical objects or space, so if you're at the grocery store and you're handing somebody your card or cash, I think washing your hands before and after exchanging objects is really important. I think wearing masks in public is probably the new normal for the conceivable future. I think for me, I would say
if you're in close proximity.
If you're in close proximity, right? Yeah. If you're on a hike by yourself or with members of your household, it's a different critter. I think for me, they talked about one of the things coming out is contact tracing and testing. Obviously any kind of symptoms or being sick, stay home, really don't interact with anybody. As much as possible, I would say space out your interaction. So if you are going to make a decision to go to a group gathering or to go into somebody's home, that there needs to be a period on either side of that interaction. the epidemiological data that I was reading about COVID is so broad and so non-specific, but kind of the general guideline was that the average incubation period before symptoms was 5 days. So, you're looking at, and the longer end of the spectrum was about 2 weeks, where people could have it and be spreading it without having symptoms. So, if you're going to be interacting with, say a gathering, or you're going to go, do something that's a higher risk behavior, would be giving yourself at least a week, ideally up to 2 weeks on either side before you interact with high risk people. Unfortunately, I think because of the nature of this too, so because I work with patients that have COVID, my level of exposure is higher, therefore I have a different level of responsibility. And that is not always that's not always going to be fair or evenly distributed. So people who say work in a grocery store or work in Marsha's job have more general points of contact with people than anybody does, and that's a part of their livelihood. And that doesn't necessarily mean that they need to adhere to stricter social distancing policies to make up for the rest of us. It's actually up to the rest of us to have better policies in order to make up for them. And so I think that that's just from a social standpoint is, we're kind of all in this together. And so, yeah, did that make sense? Was that clear how I worded that?
Yeah, absolutely. I think that's a great point to make, that we can't say well, they're doing this really high risk behavior and that's on them. And that there's a way we can kind of redistribute that responsibility so that, we can kind of help people like, Marsha continue their livelihood,
Right.
while, not making it all someone else's responsibility. And I think that's a really good note to have in there. Carl, are you comfortable answering this question as well?
Yeah, so I agree with the points that Zachary and Dane have made, and don't want to continue to beat a dead horse. But I think being aware of the level of risk with each activity that you're taking. I know that there have been lists released about what activities are higher risk versus which are lower risk, and using scientific knowledge that we know so far, as well as your own personal boundaries and comfort zones to make decisions from there on whether you can do your next activity. Because of, if you were doing a higher risk activity, then it, like Dane was saying, makes sense to give yourself that time period to kind of see if you're going to have symptoms, and you don't have to contact half of your friends telling them that you have symptoms now. I think just kind of being aware of, each of us needs to be aware of our responsibility as humans and community members. I think we all agree that we don't want to hurt anyone that we're coming in contact with, so you don't want to have to contact hundreds of your friends and tell them, hey, I did this thing, and them having no idea that you were putting them at a higher risk. So using that common sense that we have as well. I had another point, now I'm forgetting what it is. Give me a minute to think. I don't know what I was going to say, but definitely being aware of things like washing your hands, and you can check in with your friends about how often they're washing their hands and making sure that their standards, or at least when they're with you, is up to what you're doing, but you can try to keep yourselves as safe as you can.
Yeah, absolutely. And if whatever thought that was that escaped you, Carl, if it occurs to you while we're finishing up this conversation, just type it in the chat box. We have quite a few great questions in the chat box, and I'm thinking that the best way to comb through these is going to be just as Lorin reads them off. If any of the panelists really feel that they would like to answer, I just kind of give you guys free rein to chime in on those answers. I just want to note that we're about 7 minutes away from 7. Personally, I'd like to get through the questions, but I don't want anybody to feel like they have to stay on the call. And I know Dane and Aletha, you guys have something else scheduled at 7. So I just want to recognize the time, and if 7 o'clock hits for anyone and they need to pop out of here, like, please understand that that's totally okay. And we're just going to go from there.
Alrighty, so Dar asked the whole panel, he's curious if anyone is noticing a significant shift in the last days with people becoming more comfortable, maybe even too comfortable, in which people are not distancing, washing their hands, etc.
I guess I'll start with that. I don't fly much anymore. It's a good thing we have checklists and manuals. But I flew a number of days ago, 2, 3, 4 days ago, which I hadn't flown before then in like 20 to 25 days. So it was a big shift from when I was kind of in it and it was really coming down, and then kind of on the backside of it here a little bit. And I absolutely have seen a shift. My aircraft, I flew a number of completely empty aircraft when it was really going through it. And now there's, I sat in the back of an aircraft just commuting. And I was in a row with 2 other people. So I was in a full row of people, definitely not social distancing. I'm literally rubbing elbows with a stranger. And so I have definitely seen a shift in that. There's supposed to be social distancing on aircraft. It's kind of in this area of feeling lax. So I definitely have seen a shift, at least from what I'm seeing out there in the airports.
Okay. The next question we have in the chat box, Molly from Precipitation Northwest wants to know to the panel, is there a real worry that protest gatherings will impact COVID spread or bring on some kind of second wave? And I know none of us are epidemiologists, just from like a personal perspective standpoint in this.
From my personal perspective, I've been following the news, and obviously everybody is talking about a second wave coming, and with the COVID and the protesting and everything else, I mean, it goes into everything that they told us not to do, right? Not to be in big groups and stuff like that. So I think for me, of my opinion, I feel like there's a new resurgence is going to happen, but it's like, these are where you make your choices, right? Both of it is life, It's like your life, and you die and you do something and you go down fighting, or you go down sitting down and waiting for people to change the world for you. So I don't know. That's kind of how it is. It's like everybody just do what they want. Hopefully everything happens and all of our people come into realization and realize what's best for us. There's a lot of different information out there that we don't really know about. And so just take care, make sure that we do the best we can. And like everybody else said around us, being consensual, in periods, and making sure that you don't do what you need to, don't have to. And then we'll take it from there. I'm out.
I would like to comment on that as well. I have decided to go to the protests for a few nights. I've gone to 3 different nights of protests. So from firsthand, the organizers are trying to be really good about handing out hand sanitizer. I've seen that anytime they come in contact with someone, there's hand sanitizer. Everyone's wearing face masks. They're giving free face masks to people if they don't have them. And kind of doing your best from there, because obviously we're all going to be close in a group together. But I think everyone that's at these protests will agree that this is something that really can't wait. So I think it's not a question with a great answer on either side of it. I'm sure there's people that will disagree that I've gone, and that they're happening at all. So it's hard to say. A thing that I've thought about that I've can see frustration coming out from is that in other counties in Oregon, pretty much everything except Multnomah and Washington, right? And that might be it. At least those 2 counties haven't reopened anything. We're not in phase 1 yet. But 2 weeks ago, when everything reopened, I went down to camp in Central Oregon, which was open. So they're open there. So, you know, I traveled like 3 hours. So some people may say that was unnecessary travel because it was out of my county as well. But we decided that camping and being in an outdoor space, you know, we kind of weighed our mental sanity with it. So we were there. And this kind of touches on another question. People where things are reopening are not wearing masks. They're not still wearing them. I went into a gas station. The only places that we went into were the grocery store and the gas station when we were there. And a lot of people there were not wearing masks, a lot of the customers. So the frustration is that people are going to blame the protests on higher numbers when it very well could also have a lot to do with people going out in places that are open. They may be lower risk, but if people from higher risk places are going there, then that is increasing the risk there. And we could see these numbers being a little skewed with that, but there's so many factors.
Absolutely, I agree. There's just like so much. I mean, there's hard data bits that go into it, like number of people wearing masks, and these are a percentage of people wearing masks in, you know, grocery stores in rural Oregon versus, you know, people wearing masks in Multnomah. And then there's warm data that's really more about like these protests, at least from my perspective, can't wait, you know? And I've been down there and we wore a mask, we used hand sanitizer, we did, like, I'm not a part of the crowd kind of person, so I did stay roughly 6 feet away from people at most times, but I mean, it's also not something that I personally feel I can sit by the sidelines on. And I think this kind of rolls into Dane and Aletha's question. I think I'm actually going to have Dane and Aletha ask it though, so that they can elaborate further on what they meant. And I believe that this question is for the room as a whole, right, guys?
Yeah, I have some thoughts and ideas, but I'm curious to see what other people's perspectives are as well. So it's, yeah, kind of a question I have some answers to, but it's not, you know, I would like to get other people's feedback too, and to have a more robust perspective.
Yeah. The thought that I think that we've had, Carl's point about, reopened spaces. We went to Alvord Desert and drove through Burns, and people were not wearing masks. They were like Yeah.
We were the only ones in the Safeway wearing masks, and there were elderly people around, and there was definitely like a heightened sense of responsibility being in that situation, realizing we come from an urban area that's heavily populated where we're interacting with more people and there's higher rates, and potentially moving that to a more rural area with a smaller hospital and more limited resources and all of those kinds of things. So
I mean, part of that, the question, the way that Aletha specifically phrased it was, what are the goals and values that we're using moving forward to guide our decisions? So,
like, what's the why? What's the motivation and the reasoning behind it? And I guess I asked it that way because I'm kind of a systems thinker. And so I want to look at the big picture and like, okay, what's the point? So we're not trying to eliminate it or eradicate it completely at this point. It just kind of has to circulate through the population in some capacity. So what are we trying to accomplish? Like, what are we trying to do now? What's guiding? Like, what's the motivation?
Right. If the original point of total shutdown of businesses and public spaces and that sort of thing was the hope that the population just wouldn't circulate through the population. It sounds like by choosing to open right now, we're acknowledging that is no longer the target.
Or a possibility then.
And so, the idea of herd immunity, meaning that like a certain amount of the population gets exposed in a slow enough period of time, that we build up enough people that are immune that it's no longer able to spread
as easily
or at all. There's a number called the R0 number, which is that they use in epidemiology where they talk about like the number of people that get infected by each infected person. So COVID's R0 number has been calculated somewhere above 3, meaning that each individual person who's sick in a completely new population typically will infect 3 other people. But if you get any disease down below 1, whereas each person, not every person infects another person, then a disease will eventually die out. And so I guess that's the question through this is, what is that number that we would have to reach in our population where enough people have been infected that this stops being able to spread? And I don't have the answer for that, but.
And I think for me, when I was thinking about this, I guess the thoughts that I had are, obviously it's not going away at this point. So what are, for me, the 2 big kind of answers that I or thoughts to this question are, to not overwhelm the healthcare system, not have everybody get sick at the same time, to be able to conserve our resources in a way that makes sense, and I think that's been kind of a goal that wasn't necessarily clear at the very beginning, but I think as this has progressed, I think that was probably the main goal of the initial quarantine, is just to allow the manufacturing and the healthcare systems to kind of get up to speed with everything so that we have the resources and systems in place to be able to treat people when they get sick. And then kind of the secondary goal for me, I guess, that's motivating me is to protect the most vulnerable people, or at least allow people the ability to consent. I don't know if there may be more, though, or there may be other thoughts or perspectives that I'm not, thinking of. And I guess that's what I was curious if I always want to know the why. Like, if I'm doing something, if I'm drastically altering my lifestyle, I want to know why. Like, what's the motivation or the value or the behind it?
Yeah, I think your guys' question is really kind of, for me, what the purpose of this entire conversation was. Like, how can we address what our goals are moving forward, and like what's motivating that? I think we'll popcorn through this answer throughout the room if people have something they want to chime in on or whatever. I guess my 2 cents are just simply like, now that COVID has really kind of sunk in as as something real to the population. My goal would be that we kind of treat this opening time as a light social distancing, as was the initial ask in all of this before things escalated to where they were. So in that, anything, encompassed under that umbrella, which was slow the spread, protect the extra vulnerable, and do what we can to not overwhelm our systems and people. And so there's not a ton of us in this room, so I think popcorning through it should be no problem. And then if we run into any issues, we can moderate it. So if anybody wants to chime in, now would be the time.
It's been fairly interesting, kind of how I've been approaching it. Is with as much respect as possible, but also trying to live at the same time. I know the lack of social interaction has definitely taken a toll on my mental health. But like, just in a scenario when I'm walking through the grocery store, like if I have 3 people that are sitting in close proximity and I have to step within 6 feet of one person, I'm going to go for the younger, healthy looking people, to try to limit my exposure to the more elderly, of course. But the ethics of doing things with people, is give me a minute. I need to think about that one a little bit more.
Yeah, and I guess I just want to point out that, at least from my perspective, I don't necessarily want to call anyone's ethics into question. More so, yeah, just motivating factors and goals, for you as an individual versus there being a right or wrong in it, because I think that's part of what has made this conversation so murky. And like at some point science in the world did become dogma, and we have people debating these issues like religion and beliefs, and I guess I can see the slippery slope in saying, this is right and this is wrong, and if you're not right, you are wrong. And I guess I really wanted to like create some space away from that kind of rhetoric, because ultimately we are all going to have our own individual ways of approaching this, and how can we as a community and society do that in a way that says like, okay, your strategy is different than mine, and that's okay. Here's what mine is, and working to find the commonality in those strategies to see like, oh, maybe I can't hang out with you right now, or like I can in these ways. And I guess really, again, I think what it boils down to is just that, informed consent, and treating it like, I don't necessarily feel, and this is a great question around like ideology of information, right? Does communication take away from the sovereignty of the person communicating, or does lack of communication rob someone else of their autonomy? And I guess I fall more into the like, I'm an open book, but if I were to spend time around someone else and not really disclose my behavior, or like, you know, I live with 6 other people, their behavior to a certain degree to what I can know and what is practical to know, then I am doing that person a disservice, because I'm taking their choice and their health away from them. And yeah, I guess like, I don't think that there is a right answer in this. But if we're working to find the commonality in like where we all fall together, I think the only way we're going to get there is with communication and consent, I guess.
I have something to share. A concept that I've been hearing lately is the one of physical distancing versus social distancing. I think we have socially distanced really hard, and as some people are sharing, it's taken a toll on our mental health and physical health and whatnot. And I recommend everyone to make sure that you still go outside and you can do it safely, and you can meet someone, keep 6 feet away, because we're hearing a lot of people that are going to the grocery stores every other day, but they won't go out to nature, or they won't go out for a walk in the park with a friend from 6 feet. So a recommendation that I give is that, you know, we can still be very safe. We can still wash our hands. We can still wear our masks. We can still do all those things, and and make sure we are starting to connect a little bit. It's a part of our life, and finding a balance over there is important. Thank you.
Yeah, I agree. You know, I have a friend who had a gathering for her birthday in her backyard. And she was very respectful of her friends' ideas. She had one in their level of comfort. She had one friend who was very communicative about wanting to keep very strict social circles. So limiting it to blank amount of people, whatever that number is. And their number was definitely on the low side. So she had invited them and invited a certain amount of people, and then they ended up canceling. And so she added like a few more people just because they had a number that she was comfortable with a larger number. And at that get together, she had blankets laid out so people could be near each other, but still physically distant. Some people wore masks, others did not. So it was definitely seeing a good step within a friend circle of what looks feasible in the near future, probably for the remainder of summer, possibly, who knows. And then personally, just kind of piggybacking off that whole thought, is that for me, my social interactions are still very much looking like bring my social circles much smaller. So kind of being picky and choosy about the people that I'm hanging out with. And by hanging out with, it's usually, like Dar said, outdoor, backyard, physically distanced hangouts or hikes or walks in the park. And I feel comfortable with that. I feel like it's a decision that it takes into account different things such as my mental health, and that with looking back, I'll be comfortable with my decisions, hopefully. I mean, regardless of what the outlook looks like.
Yeah, I think that the purpose of it all for me at this point is to, and the nurses can definitely chime in, is to be able to provide adequate care. If we're able to provide adequate care with a large enough margin so that if it does take hold again, that we're not at a point where we have 2 times as many PPEs as we need and ventilators as we need, but 10 times as many as we need to really be in, again, that system that that is robust enough to take on a load that we went through before and not have the issue of not enough supply. So that's really my goal at this point. I don't believe that this will go away. I think that that's a silly notion. No one here is suggesting that. I also wonder if we're going to have not only a phase 2 of this particular strain, but what are we going to see next year? We don't know. But it is something to factor in. So one thing that I look forward to, not like, yay, I look forward to, but more like looking at is what happens next year, what happens with the next virus, what happens with things down in the future. And we're not going to want to go into lockdown every time. Sometimes we'll have to, and sometimes we may not be able to. Or sometimes we'll have to, and oftentimes it's not a robust system to do that every single time. And I'm not saying that we shouldn't do it again. I'm just saying, can we look at that? Can we look at something down the road and see like, what is our goal? How can we be more prepared for this in the future? Are there ways that we can maybe mitigate not going into full lockdown every single time? And that's not to say that we won't do it again. It's very well that we might. And it's very well, it might be absolutely necessary to do, and I'm not advocating to not do that. I'm just having us look at that question down the road. I'd actually like to call out my dad really quick, if you're willing to, just because you have a different perspective than a lot of other people here. And being at risk, and then mom being a real estate agent, and you do interact with the kind of someone that your spouse going out and interacting with humans and then coming back to the home frequently, and like just kind of your perspective on what's all going on here and the things that we've discussed.
Well, first of all, guys, it's interesting because to tell you the truth, this, from my perspective, sitting here, I am looking at a group of people that are probably easily 30 to 40 years junior of me. So first of all, to Pete, I want to say thank you very much for being cautious of us elderly people. We need that caution. And my approach to this is, and I will also own up to the fact that I know perfectly well that I'm in a very vulnerable demographic. I'm over 70 years old, and I have some underlying health issues. So having said that, and I live in a community that's relatively isolated and extremely politically aware. So consequently, my isolation and my ability to keep away from people and so forth is pretty good. It's solid. I feel I feel pretty good about, you know, where we are, what's going on. My wife is a real estate agent. She's out communicating with people constantly. Yes, indeed, I will admit to having some thoughts about what are you bringing into the house, but she's also extremely cautious, and we're being very careful. Now, having said all that, I just got back from a demonstration of people that were extraordinarily upset about what's going on in the world right now, and all of the things that we have talked about. Social distancing, masks, not talking loudly, they were thrown out the window. There was a very, very large group of people, all of who were violating all of the things we talked about. My concern is now, having been there and exposing myself to that, what does that mean for the next couple of weeks for me? But what it does to me, it makes me stop and think that in this particular case, we're seeing so many stressors, and we're seeing so many things that we have to make decisions about. And we're seeing so many things that put pressures on us socially, culturally, demographically, all these different things. And we're having to make, as somebody said earlier, you have to make some decisions. You have to make some choices. You have to act responsibly, but at the same time, in this particular case, going downtown and being with that group of people and standing there with them was a social requirement that outweighed the risk. So, and I think we're all having to do that. I think we're all having to go through that now as we sort of go into our different phases. I don't know what Oregon's going through. We're in the state of Washington, and we're very cautious here, but we are opening up. Somebody talked about it earlier about, you know, what are the changes? What are you seeing? Here, we're definitely seeing people starting to get much more lax. No doubt about it. Will we see another wave? Absolutely. When it comes, I'm not entirely sure, but you just know it's going to happen. One of the issues with that, as an old guy sitting here looking at this thing and having gone through many, many years of stuff, I'm looking at this thing and saying, there's so many unknowns. I don't know how to react to it. I don't know how to you know, they talk about testing and they talk about, you know, tracing and but none of it's there. So consequently, you know, we just don't know. We're going into a place we don't know about yet. So it's going to be fascinating in its own sort of odd way. But yes, indeed. Thank you for asking the question, Zach. I do have a different perspective. I am an old fart, and I am extraordinarily careful for the most part. And I do draw a line, even with close friends, and say, I can't let you in the house. And it's unfortunate. I don't like it, but there it is. So that's my 2.5 cents worth.
Thank you, Dana, for sharing your perspective on this. I mean, there's so much information out there, and all of it together doesn't make sense as one unit. And so I think some of the only ways to make sense of this are by kind of communicating with each other in this. So thank you for sharing a perspective we'd yet to cover in the conversation. I think we're pretty close to wrapping things up here, but one question that did pop up in the chat box is from Dane, and he wants to know if anyone has ideas for potential non-socially distanced events eventually, whether that's a special occasion or a scheduled event, what that might look like and what precautions might be taken. Dar, if you're comfortable starting to address that question, I think that you as an event promoter might have a unique perspective on that.
Thank you. Yeah, it's a great question, and a lot of people have asked me that actually. I've talked with a lot of different people, a lot of different event producers and people that bring people together, and people in Israel, people in California, people in Oregon, people that put on festivals and large events, and, you know, no one knows. And obviously none of those people are, you know, experts on the issue and have any prediction better than anyone else. So people are just waiting to see how things are going to unfold. But you start hearing different conversations about, you know, things are going to open up, what it's going to look like. There's probably going to be, if things improve in the way that they have been, the assumption is that small events of 100 people or less would start opening up in a lower capacity. With some regulations, anything over 300 people will probably not happen before October in Oregon. Kate Brown basically kind of announced it already. I'm sure there's going to be different kind of like small outdoor gatherings, like distance in parks and things like this. But anything like a concert or like big events like this, I think that we're looking at least October or later, but I don't know. Nobody really knows.
Definitely. And then I'd like to open the question up to the room. Dora has a unique perspective as an event promoter, but then where's everybody else at on, say, like a dinner party at a friend's house, or, you know, so on and so forth? And what are some strategies people are seeing or participating in, or so on and so forth, that they either like or are uncomfortable with? I'll start it off. One that I've heard of is someone hosting a small gathering of 10 people or less in their home. And in the invite, they asked their guests to please check in with their household before attending. And I think that that's a really cool example of really trying to promote communication in this.
So for me, is that I've noticed some people are having little gatherings and like, whereas like you say, it's consent. You know, for me as it is now, as I'm opening up, we have to have this list of questionnaires and things like that, regulations and protocols that I have to send out before every appointment, which pretty much just ask you things such as symptoms. Do you come in contact with anybody you know of? And it's just like a self-check thing. Like, have you been in 2 weeks? You know, that type of thing. And then you answered no to all of that. And then one of the questions I put out is, are you willing to wear a mask the entire time? And then people come up and they go, do I wear gloves? Do I whatever? So whatever is your comfortability. This is what's going to happen here. We have 10 and less people here. The place is big enough for all of us to be 6 feet apart. You bring your own closed water bottle and your own snacks if you want to. We have closed snacks and it's all individual snacks if you want to. And you have like picnic blankets or 6 feet apart. You know, so we all think of doing things and it's like 5 feet apart, because at the end of the day, we need human interaction. We will die of loneliness. Loneliness and depression kills more of us every day than anything else. So where there's a will, there's a way. And I feel like just standing like today, going and having gelato 6 feet apart, and my kids and all of us screaming at each other from 7 feet away and saying, hey, how you doing? It coming away from that, you felt lighter, you know, because energy is energy. And as much as we want to do the virtual thing, we do need an exchange of energy. And so I feel like it's consent with precaution. You come in, you tell everybody, no, this is what's happening. And then as you step in, and as a group, I think you guys have always done this, is ask everybody, this is what we accept and this is your level of okay with. So you enter into this place as a safe space. And that's what it is. It's consent all the way.
So a word keeps coming up for me, that's consideration, and to the point of radical consideration. When looking at all of these questions coming up, like what direction do we want to be moving in? What goals and ideals do we want to have in mind? What is okay as far as social gatherings, et cetera, et cetera. Compassion and consideration both come up for me. Radical consideration in the sense that as everybody is talking about this, bringing up like the consent and being able to ask ourselves the questions of that we've never had to ask before, of like where I've been. Again, all these things have already been covered. But also being able to be considerate of other people and the global picture. So like whether we go to a rally or not, I think that so much of that answer is beyond just the risk management. And we really have to look at like, what does it mean for me to be compassionate to and considerate of the total scope of where we're at in the world. And in that sense, like, absolutely, it's important that I'm able to mitigate risk and also be okay with risk to show up for something that's really important. And so if that is a rally fighting for human rights, I think that that's really important to be able to keep compassion and consideration in the forefront of our mind. And also, like, in looking at, Abigail, you touched on it, the differences between the way that people are showing up in this. Some people may not hold the same ideals, the same standards for their life and for the way that they interact as I may, or as you may. And I think that having compassion for that is also really important to understand, like, okay, that's how you choose to show up. And while that may be really triggering for me, that may be really challenging, I also understand that that's your life, your decision. And and that also brings up a question for me though, because I also believe that it's something that I struggle with in terms of helping to educate people. And if that's something that is an opportunity when we see things that we don't agree with, to help others maybe understand that maybe they're ignorant to the ways that their decisions are affecting themselves and potentially other people. And as members of a greater society, is that our duty to help inform others about something that we may feel strongly about? Or is that something that we just really dictate for ourselves, and when there's something that we don't agree with or that we're not comfortable with, stepping away from that? Yeah.
So
I don't know, it's kind of a tying all the together.
I think what you're touching on is a really important point to letting someone be a sovereign being, as well as the understanding that as human beings, we are like inextricably connected. And so, like, I think you're getting into a really deep sociological issue where I don't know at one point in our human history, I don't know sociology that well, but we as humans reach this: if you have a difference of opinion from me, then you are my opponent, versus we have a difference of opinion, and as a human to a human, I would like to understand you. And so I think that the more we let go of right and wrong in a situation, and instead approach situations as a desire to understand, and then secondly to be understood, I actually think the further we'll get. So instead of me saying like, this is the way that you approach COVID, if you don't do it this way, you're killing other people, right? And that's tempting, right? Because I have a lot of feelings involved in this. I have a lot of people I love, like Dana is my father-in-law. I want people like Dana to survive. and so I do have a lot wrapped up in this emotionally. And it's not my place to blame someone for a global pandemic. And so instead of saying like, you're wrong and I'm right, and I'm going to teach you that, saying like, I feel differently. I want to understand where you are. And it would mean a lot if we could also understand where I am. And it's okay if we both walk away from this still feeling differently. But if the conversations are more focused on understanding and consensus versus right and wrong, I actually think that we're going to be able to get through to each other a lot better. Because the reality is, like, as a social species, we don't want each other to die. That's not how social animals operate. And because in the human rhetoric we've decided someone who disagrees with me is my opponent versus someone who disagrees with me is an opportunity to understand myself better, I just think that there's so much further progress we can make by looking at these moments of tension as opportunities versus what am I trying to say? Versus obstacles. And I guess that's just kind of my approach on it. And then someone might walk away from a conversation with me being like, that's ridiculous, I don't agree with that. And I might walk away from a conversation like that too. But I know that I'm going to feel better walking away from these conversations if I have really worked to understand that other person and know that, like, hopefully they did their best in the same. But I think that we treat other people in the way that we're treated. So if you can approach a situation and really show someone you want to understand them, there's way higher odds of them trying to understand you. And I think that that's really kind of my hope over the last couple months. And it's, I I've realized it's needed to be more than an approach but a practice, because it is so ingrained in us that someone who disagrees with us is a plant.
Yeah, I'd like to touch on that as well. I like to frame a way that I've been thinking about conversation and community within a frame of game theory. And that is, we can either play a finite game, a goal to an end, a goal to end, a goal to be right, a goal to a finish line. Or we can play the infinite game, the goal to continue playing the game. In order for a game to start, the teams or the players have to want to play. And that's the hardest part that I find, is that in order to play the game, everyone has to show up. And I'm still figuring out how to get people to show up. That's the hardest part that I see. But if everyone's willing to show up, then the goal for our communication, the goal for our rigor is, love you, Dar, thanks for coming. The goal for our communication is to continue to communicate, continue to find whatever signal it is that the other individual or the other group is trying to communicate. And if you don't continue to ask questions and you don't continue to try to find that clarity, you won't. It's a constant game. It won't end. And so that's kind of the goal that I see. I want to read a piece that I wrote. It was a while back now, but I think it kind of tailors nicely into this conversation. Then it goes like this. If we want to empower people, I don't want them to differ their sense making from me, but I also don't want them to do lazy, shitty sense making or to differ from someone else. I want them to grow the quality of their sense making, which means to grow the depth of their care, to grow the depth of their earnestness and their depth of their own reflexivities, to pay attention to their bias and where they go sloppy in their own thinking. Clarity or intuition, this is an increasing of sovereignty. And so I think that as we do our best to find more and more clarity within whatever anyone else is saying, we're able to find our own sovereignty in that as well. And that is an infinite game. A game that we're not taught to play, right? I grew up a soccer player, a swimmer. I'm taught to win. And I've had to make a really cognitive shift in community to play the infinite game, to play the game of let's keep playing this game for as long as we possibly can.
Yeah, absolutely. Thank you. If I'm gonna first check to see if anybody has anything to add to that. And then if they don't, I'm gonna end the recording and give us some time to just, catch up or say goodbye to each other while recognizing that people have patiently hung around till 7:40. So just quick check-in with everyone, just make sure there isn't anything else there. This recording, once I figure out how to post it online, will be posted online. Along with some notes, as well as links to resources and things like that. And I just really appreciate everyone taking the time out of their evening to have this conversation with us. I think socially, and so being able to conversate with people whose opinions and thoughts I value so much really helps bring me clarity. So thank you, everyone. I love you and I appreciate you.
Yeah, thank you for, bringing this conversation forward. I think I just had one quick thing to add, kind of piggybacking off of what both you and Zach had just been talking about. I, as a person who struggles with boundary setting, I'm a people pleaser, and I have a lot of anxiety around boundary setting. And it's challenging for me, so I overcompensate sometimes by having really harsh boundaries. And so something that I'm learning is that the content versus the approach are two things that I'm learning to differentiate. The actual request or the content of what I'm discussing with someone can get very different reactions based on how that is approached. And we had a situation in our personal life where we had to have some really difficult conversations with someone in our life who had different viewpoints and opinions about how we should navigate this space. And there was a lot of, I tried to deal with it with one approach and created a lot of conflict, and then Dane came in with a different approach and had a much better outcome. And so it's something that, you know, it's a learning process for myself, but I think it's an important piece of this too, is you can send the same message in two different ways, and doing it in a way that's compassionate and loving, and coming from that space of trying to find the common ground and really trying to find a resolution that works for everyone tends to be much more effective than just having a harsh boundary and reinforcing it and, you know, viewing the other person as the enemy. So lesson learned. But yeah, that's all.